So my name is Andy. I'm an organizer with the Vermont Workers Center.
And I'm E. I'm also an organizer with the Vermont Workers Center.
And this is our presentation. Healthcare is a human right. What's driving Medicaid cutoffs and what we can do. So in this presentation, we're going to be describing the social forces which led to the institution of Medicaid in the 20th century and the subsequent expansion during the 2020 pandemic. We'll be kind of tackling the narratives of who benefits from Medicaid, kind of unpacking the effects from Medicaid unwinding and Medicaid cutoffs. We're going to reveal our history of organizing with the Vermont Workers Center and winning universal healthcare in Vermont. Spoiler, we have universal healthcare in Vermont. And we're going to propose an action plan for folks who want to become involved with us today. And without further ado, I'm going to hand it off to E to explain the history of Medicaid in our country.
So next slide. Who is doing this? Oh, that's so
sorry,
funny.
I forgot that we had fixed that.
Just to the ether. Next slide.
I think that's. There we go.
Love it.
Thank you so much, guys.
Does anyone know what year Medicaid began in the U.S.?
Pop quiz.
Pop quiz, yeah. Decade. Shout out a decade.
60?
Yes, perfect. 65. So right dead center. I think you got it. It was passed under the Social Security Act.
Social Security, that was the 30s, Roosevelt.
It was a Social Security Act of 1965.
But Social Security, it was originally created in 33, FDR.
Awesome, thanks. Yeah, it was under the Lyndon B. Johnson administration. And just kind of broad strokes overview, Medicaid and Medicare and other social programs were passed under this act. And they are both avenues to direct public funding towards healthcare costs for people who cannot pay for it. Medicaid typically covers both adults and children and pregnant people who have low incomes, and Medicare traditionally covers the elderly and disabled. And so in 1965, when this happened, there were multiple social forces going on that actually pushed the Johnson administration to be able to do this. The civil rights movement was going full force. There was a lot of social unrest. Poor and mainly Black communities were demanding access to basic public goods. And it was really difficult to access healthcare. Hospitals were segregated, and healthcare and health insurance was a luxury to many. So the federal government, feeling the pressure of this unrest, felt that they needed to do something. There were genuine good intentions within the administration, and there were lots of economic reasons to do this. But ultimately, they did want to avoid deeper unrest and demands for radical change. Medicaid and Medicare became a limited reform to pacify some of these demands without actually challenging the deeper infrastructure of the system and the for-profit healthcare system that we had. So what do you think could have happened if they, per se, hadn't passed Medicare, Medicaid, or these social reforms? Does anyone have any ideas? What's that?
Upheaval.
Upheaval, exactly. Revolution, exactly. I love that word.
Denied basic people. A wounded an animal's most dangerous when they're wounded.
Mm-hmm. Yeah, so these broader creative solutions like universal health care that would drastically change the system was on the line. At the same time, the medical industry itself was expanding. There was a lot of investment after World War II into hospitals, into medical technology. There were massive expansion of beds in hospitals, but they weren't filled. there was a huge amount of people who could not pay for this health care, and that was the poor and working class folks. So Medicaid, in this sense, created a way to funnel directly government funds into the hospital system, the pharmaceuticals, into the greater healthcare complex. And this ultimately turned the poor into a new and profitable market. So ultimately, it was a victory to get Medicaid, to be able to cover millions of people across the US and get them access to health care. But it also benefited Wall Street and the corporate sector of the healthcare system in two specific ways. It allowed for social control in this time of civil unrest, maybe mitigating upheaval, revolution. And they opened this new source of capital for the hospitals to directly be able to access.
Okay. So now that we've kind of covered the history of how Medicaid has been implemented in our country, I just wanted to take a moment to kind of pause and reflect what the subsequent narratives have been around Medicaid in our country since then. Because obviously in the 60s, this is something that was heavily fought for. And I think since then, there have been kind of a lot of narratives that have been kind of working against it. So I'm going to open this up. What do you think about when you think of Medicaid? Or what do you think about people saying about Medicaid when you think of Medicaid?
And there's a lot of truth behind some of those narratives there.
Yeah, for sure.
Like that third one brings home, because I remember during Bush too. I mean, one of the places I would work was at a food pantry, and one of the people, it was an elderly couple from the Azores who came to America, partly because they couldn't get treatment in the Azores. Mm-hmm. And they would always say wonderful things about the place where they got treatment. But the problem was, within a few years, that hospital got so bad that they would use that one success story to mask the reality of abuse that was going on there.
Yeah, for sure.
What were you saying?
A lot of times if somebody has Medicaid for their insurance, there's a stigma attached to it that they are on welfare or lazy or not intelligent, which is definitely not the case.
Mm-hmm.
Yeah, I think that's very true. There's an article that was published by Health News Today that was actually a study on the language surrounding Medicaid that was used by lawmakers in our country, kind of how it influences public perception of people who are on Medicaid currently. And a lot of this currently is helmed by Republican lawmakers. A lot of who are saying that people who are Medicaid are abusing the system, they're not hardworking, they're taking advantage of the system. It really kind of echoes the kind of archetype of the welfare queen that we have, and it kind of introduces these stereotypes in our mind, these people to blame when these systems aren't working as we think that they should be, or if we see that so much money is being spent on Medicaid, it creates an easy scapegoat, right? If we say, oh, it's just the person who refuses to work, or the person who won't stop having kids, we can kind of look towards our fellow people and say, who's responsible for this? And because we have these narratives, I think it lets a lot of lawmakers off the hook. I know I mentioned Republican lawmakers earlier, but we also have, when we're talking about Medicaid cuts currently, we also have a lot of Democratic lawmakers who are saying we have to tighten the belt, we have to pare it back, we have to look at our priorities. So I think that kind of is important to keep in mind as we're going forward, and kind of talking about when we did expand Medicaid. That's our next slide.
Yep, so fast forward to March 2020. The COVID-19 pandemic had just been declared a public health emergency. People were terrified, hospitals were overcrowded, and people were losing their jobs and their health insurance as well. So we were in this crisis, and the healthcare system itself was at risk for collapse, not just medically by being overcrowded, but socially, financially, politically as well. So in this time, the federal government responded to this crisis and expanded Medicaid. They required states to keep people enrolled instead of kicking them off when they lost their jobs. They expanded eligibility. They gave some more funding to states to pay for that expanded eligibility. And they made it easier to enroll and not go through the bureaucratic hoops. And there was actually bipartisan support for this expansion, and all states expanded Medicaid, and they were required to. But it's important to kind of remember the origins of Medicaid, and the goal wasn't just compassion, it was crisis management at that time. They were able to keep the newly unemployed folks covered by health insurance, to keep the hospitals functioning financially. And then similarly with the mass unrest, it prevented public anger, outcries, and further radical revolutionary thinking and organizing that could have brought us to a different system other than Medicaid. And so something that we can learn from this fast and massive response from the federal government is that they are able to expand the healthcare system quickly and effectively when there's the political pressure.
Yeah, awesome. So what were the effects of people being covered by Medicaid, more people being covered by Medicaid across the country? So we have here kind of this chart that illustrates kind of what populations were most represented by the enrollment growth. So we have my eyes immediately going to children under 19. 7.3 million children were now covered by Medicaid. You have people who ACA adults, other adults. So we have a 20% increase in kids being covered across the country during the pandemic. 1.3 million adults who are eligible because of disability or advanced age. And then if you're just looking more locally, if you're looking in Vermont, we have 30,000 Vermonters who are now covered by Medicaid, which is 5% of our population. So if you think about this, suddenly another 5% of our population had access to low cost or free healthcare because of this Medicaid expansion. So pretty great, right? We're gonna have this forever, right?
Right?
Well, maybe not. So we have right here the 2023 unwinding of Medicaid. So even before 2023, there was a lot of political conversation about when we were going to pull back Medicaid enrollments. But the official, and states did it on different timelines. Some states started earlier than others. But the federal Medicaid expansion was ended in March 2023, which left the millions of people we saw who were just covered by the expansion of Medicaid in a newly precarious position. Something to emphasize is that this was a bipartisan decision. And it happened under the Biden administration, a Democratic administration. Kind of administration who ran criticizing, the response to the pandemic of the previous administration, which, to be fair, was bad. Um, but sort of, they all use this framing of unwinding, of kind of like undoing this emergency temporary fortification. And using this language, they could really frame this as something that inevitably had to happen. We can't keep funding this forever, right, guys? We're gonna stop doing this, right? And so instead of framing this as a conscious decision to kick millions of people off of their healthcare, they could just say, well, you know, it was the end. Nothing we could do about it. And because of this, millions of people lost coverage. They lost access to healthcare that they had previously had for 3 years. And often it was for paperwork reasons. People not signing up again for Medicaid in time, not filling out the paperwork correctly, and not even necessarily because they were no longer eligible. So there's all these people who can't afford healthcare, but who also no longer have access to Medicaid. And this was the largest de-enrollment of Americans from healthcare since the Reagan administration. So, since the Reagan administration, and this happened under Biden. So we're going to go to this next slide here and kind of bring it back to Vermont. This is a graph here that, as you can see by the title, it shows the top sectors lobbying in Vermont by the amount of money spent. And if you look here, the top bar here, that is 2 times the size as the next largest bar, that is healthcare. That's healthcare lobbyist spending in Vermont in the year 2018. It is over $1.5 million, and that is not including pharmaceuticals in there. Pharmaceuticals are the 5th largest in this chart. So this is just healthcare, hospitals, clinics spending during that year alone. So who has the incentive to expand the for-profit insurance market? And I think we could, this is a really rich graph, and I want to raise the question of what we can learn when we look at how much money is being spent in order on healthcare, and what that money might be being used against. And before I move on, well, as I'm moving on, I'll also say a question. Do you think the lobbyists and the healthcare profiteers who spend all this money, do they think they care about our healthcare?
What do you think? You're gonna know.
Not at all.
Hey,
Maybe.
welcome.
Yeah.
But we have to ask them all, but I'd say maybe in the middle, just to be on the safe
Maybe.
side.
You know, I think they care. Can you just go back a slide?
Yeah.
I think they care a whole heck of a lot. They're spending 1.5 plus. The bar goes off the page, basically. Is that 2? I don't know.
Yeah.
Is that $2
Not
million?
Yeah.
And double the amount of what they're spending on energy in order to keep the status quo as it is. Petra?
Could you clarify what the spending is actually on?
That's a really great question. So the lobbyist spending, so that's spending on lobbyists directly talking to our government officials, basically. So it's kind of just dollars spent influencing what laws get passed, what the state decides to put in their budget is a big reason why they send lobbyists there. So when you're looking at the amount of money spent there, that's how much they're spending on us not changing the healthcare system as we have it right now, which includes our system of health insurance, how we fund our hospitals, every thread that's in that great tapestry of the healthcare industrial complex. They're saying,
Yeah.
don't change it.
So we don't have the granular data of like what bills were the lobbyists talking about, but this is how much particular lobbying and advocacy in the healthcare corporate interests, how much money was spent on that.
Yeah.
Yeah, but that's a good question.
Yeah, and I think for additional context, we're going to talk about this a little bit more later, but Act 48 was passed in 2014, and that is an act that guaranteed universal health care to Vermonters, which you might be like,
Yeah.
that's weird, because I don't feel like I have universal health care, but it does enshrine in our Constitution that every person who lives in Vermont has access to equitable health care, basically. I think the year that this was happened, 2018, is important because that law was passed but was never funded legally. So when I look at this chart, this is the amount of money that they're spending for it basically to not get funded. If that, then we'll talk more about kind of our organizing work around that later.
Yeah. And
Do you want me to go forward?
yeah, you can do the
Yeah.
next slide.
Oh, Jesus Christ. All right, there you go.
So they care this much because they know that there's a lot to lose, a lot of profits to lose, and they know that there is 99% of the Vermont population can organize to work towards that. Now, we've talked, they know that we care as a population about this topic. They care and they can throw money at it, but we care and we have the numbers. We've gone out and done photo petitions, which we have here today, with Vermonters all across the state, heard their healthcare stories, people's families, loved ones, their own lives have been saved because of coverage on Medicaid, or they have lost access to life-saving or life-altering treatments because they have been denied coverage and are in that space where they're not able to get it for some sort of loophole. I've worked in the ER and seen the result of that, where chronic conditions result in complications that just snowballs and snowballs, and it doesn't have to be that way. And so this is a uniting issue for Vermonters. Everyone has experiences with the healthcare system. Everyone needs coverage. And despite or across the political spectrum, we can really be united in that shared goal. So I'll pass it on to
Yeah.
Andy.
Yeah, absolutely. So we're looking today, we talked a little bit more about the Medicaid unwindings, but the conversation nationally now is about cuts to Medicaid on the funding on the federal level. As we mentioned earlier, Medicaid as a program is funded both by the federal and the state level. So basically what has been proposed is cutting all of the federal level spending, which would leave states in a huge, huge bind for figuring out how to fund this program. And legislators find themselves in a really tough position. They are under pressure to cut the budget, for our billionaire tax cuts that we need to have to make the economy go. Sarcasm. But their constituents are angry about it. You've seen all of the protests that have been happening across the nation. People are really speaking up against this. And despite what narratives have been passing or have been kind of being created around this, Medicaid is a pretty popular program. A lot of people are taking care of it, and I think keeping people healthy is sort of a popular political position. And they see not only the services of everyday people being cut, but you see veteran services being cut. You see the possibility that like across the spectrum, people are going to be really angry about this. And I think they are. We have always been united when it comes to protecting programs like Medicaid and Medicare. And you have the people who are on the programs speaking up against it. You have the people who know people who are on the programs speaking up against it. And you have employers are in trouble because they can't cover their insurance costs. Insurance companies are trying to lower their expenses. Hospitals want to maximize profit, and this is all a perfect storm of forces kind of battling against each other. And I think we, the people, are also getting stronger, because when we share our stories, we're kind of fine-tuning our strategic tactics, our decades of experience. And in the Vermont Workers Center, we have a history of organizing to win. The corporations who profit from our health, they are counting on us to feel isolated, to feel shamed when we can't afford services. They are counting on us to stay quiet about the injustice we are facing. But when we come together, we are powerful. We have loud voices, and we know what rallying 200,000 voices in Vermont can look like. We know it because we've done it.
We've done it. And can you just go back or one forward? There you go. And yeah, I just want to highlight this kind of breaking point. The federal government administration is making these budget cuts. Congress has to figure out a way to make it work. And they're promising constituents that they are going to keep their benefits, that they are not going to defund Medicaid. And there's this kind of breaking point in this corporate plan where hospitals want profits, but insurance companies don't want to pay a lot. They want their profits. Employers want premiums to be low so that they pay a smaller amount for their employees. And so it's kind of this mix of different goals, whereas we, as the general people, the beneficiaries of the health, or the users of the healthcare system, we are united. We're like, we want healthcare.
Yeah, thank you for clarifying.
Yeah. Did anyone know that we have universal healthcare as a legal right in Vermont? Yes, excellent.
Yeah.
Act 48 was passed in 2011.
Sure doesn't feel universal when me and others are going through it.
Yeah, that's exactly right.
Not being able
Because
to get
it's,
treatment for something essential, that's not universal health care.
it has not been rolled out. We have the right to it, but we're not getting it. Exactly. This was the first law in the country to say that healthcare is a human right. It's an act that committed to covering every single Vermonter, but the language of the act strategically excluded any funding strategy for it. the Workers Center was very involved in the process. They had been organizing for a decade, knocking on doors, canvassing, calling people, doing phone banks, speaking at town halls. We were invited by Senator Bernie Sanders to give all of these panels. And all of this momentum built up, pressured legislators, pressured Governor Shumlin at the time, and we were able to pass Act 48 in this small state of Vermont. That grew national attention. Everyone kind of turned and said, what just happened? In particular, the Rockefeller Institute brought a lot of funding into the state to sway the legislature, put funding into campaigns, and also created actually distracting grants for the Workers Center themselves to focus efforts in different avenues like unionizing, labor. And this completely stopped the momentum and probably resulted in that huge healthcare spending in 2018 that we saw in that graph. In the state of Vermont in particular, because there was a lot to lose. Since then, we haven't been able to pressure the state government to fund this act that is still in place. So just to reiterate, the corporate healthcare system cares a lot about our healthcare and how we get it. And they care a lot because they're scared of what can happen if people organize and unite for one specific goal, which we have. So as the Workers Center, we actually collaborate with a lot of different organizing groups across the country, the Nonviolent Medical Army, the National Union of the Homeless, and then international groups, like in Cuba. And this is a really great quote. It's on the back of my sweater. You only get what you're organized to take. And so we saw this in 2011. We were organized to pass this act, but did not know the fine details of the funding. And we were not organized beyond that because there was lots of the strategic funding coming in that thwarted it. So we've already built this statewide movement, and today, and moving forward, we have the opportunity to keep that energy going, to find it again, and to continue with the plans and the theory of change that we have as an organization. We have the opportunity to create aid networks. We have the opportunity through sharing our stories like we did earlier today to say, no, we're not going to be isolated in this struggle. We're going to talk about what's going on and what people are facing. And we, through doing all of this and talking about it, we have the opportunity to shift the moral narrative of healthcare as a human right so that we can win it.
Yeah, absolutely. Like you said, we've organized to win before, and we've learned from our mistakes, and we're here to organize once again, become as powerful as we were then. So how are we going to start today? So today we have some steps you can take to start getting involved. There are two things you can do here today before you leave. One, you saw earlier those photo petitions that we have up. So that's just a way of you sharing your story through a photograph. We collect those and we share them with our legislature to kind of show them the faces of their constituents who are speaking up against this. We also have the option to write to our representatives and kind of demand that they speak up on this issue, speak up against cutting Medicaid, and to fight for universal health care. If you're interested in learning more about organizing with us, we have a Soup and Stories on May 6th. So that's going to be an opportunity for us to gather, share a meal with each other, kind of talk about more about our experiences and more about our theory of change. Jake is holding up a flyer right there. It's May 8th.
Oh, it's not May 6th.
Yeah. If you're interested in that, I have the sign-up sheet on the clipboard there. There's an option to say that you're interested in hearing about that. We will get in touch with you with the address for that, and address and the time. It's going to be at my house, so I don't want to share my address everywhere. But you also, if you're not able to make it, you can also sign up to learn more about the Vermont Workers Center. So you can share your email there, or your email and your phone number, and we'll be in touch with you about our upcoming events, upcoming phone drives, upcoming donation drives. If you're like, oh man, this is really great, but I don't have the time for it right now, we will keep you in the loop if you want to be kept in the loop. So with that, I want to say thank you so much for joining us today. We're going to be around until 4. Please feel free to talk to us if you have any other questions or want to hear more about events we're having. And thank you for coming here and for sharing your stories with us. Anything you want to say as we close?
No, thanks for coming out. And yep, I think that was it.
That's it.